Hey guys, this is Dr. Hub. Today we'll be comparing the low osmolar oral rehydration solution ORS versus the ReSoMal. So we start off with the low osmolar oral rehydration solution ORS. So let's look at the components. There is the glucose, there is sodium, there's potassium. So let's look at the amount. So here the glucose is about 75. The unit is millimole per liter. So it is 75. The sodium is about 75. The potassium is about 20. Next we have the chlorine and the citrate. So chlorine is about 65. And then comes the presence of citrate. Citrate is about 10. Next, very important, it doesn't contain magnesium, zinc and copper. So there is no presence of the magnesium as well as zinc as well as the copper. So all this is absent. So in total, when you add this 75 plus 75, 150, then this will be 170 and then 235 and 45. So it is 245. Next we are going to look at the ReSoMal. So in terms of the ReSoMal, the glucose is about 125, whereas in low osmolar ORS it was 75 and here it is going to be 125. Next we look at the sodium. The sodium is nothing but it is 45. And what about the potassium? The potassium is going to be 40. So it is doubling, that is in terms of the low osmolar ORS it was 20, now it is becoming 40. That is the potassium. Then when you look at the chlorine, the chloride, it is 70, it is almost about the same, that's 65 and here it is 70. Then when you look at citrate, the citrate is going to be 7. It was 10 there and now it is 7. Now let's look at the metals. So there is the magnesium, zinc as well as the copper. So all these three are present. So what is the quantity? The magnesium is about 3. So this is millimole per liter, it is 3, here it is 0.3, that is the zinc, and copper at 0.045. So in total when you add the composition, it is going to sum up to the 300 millimole per liter.